Welcome to Surviving Sickle Cell. This show is a show brought to you by Sickle Cell Foundation Nigeria and, of course, Inspiration FM 92.3. This is episode 156, and today we're going to be having a conversation that's regarding guidelines on self-management of a sickle cell disorder. And our guest today, joining me via the telephone, is Mrs. Ayo Otaigbe. Mrs. Otaigbe is a retired director of nursing in Nigeria Ports Authority, Lagos, and now head of Department Genetic Counseling, Sickle Cell Foundation Nigeria. She's also a lead genetic counseling trainer for counsellors all over Africa. Today, the 28th day in the month of January 2023. It's a Saturday, and you know that's when we run on the show. Don't forget that you can be a part of the show. You can send us a message on WhatsApp as well, 0817-313-6193. If you've got questions about sickle cell disorder, feel free to ask that question. Good morning to you.
Good morning, 100 times. How are you?
I'm fine, thank you. How are you doing, ma?
I'm doing fine, are you?
I'm okay. I hope you're staying very, very warm because this weather is pretty cold. The rain started today.
Yes, so...
Alright. So today we're going to be having a conversation, right? As regarding the guidelines on self-management of sickle cell disorder.
Yes, so
let's dive into it.
Okay, so we can start.
Yes.
Okay. First of all, effective self-management starts from having a positive attitude towards yourself.
Okay.
You must have a positive attitude. Parents too must have a positive attitude towards their children.
Okay.
Self-management starts from there. So parents and the affected individuals should not despair or they should not lose hope or look down on themselves. Parents should not look down on their children. I've spoken about all this before. Often we say all these children, they can die at any time. And parents should not have that feelings towards their children. And those who have sickle cell disorder should not have that feelings towards themselves. With modern treatment now, the lifespans and quality of lives of people with sickle cell disorder are constantly improving. So it's constantly improving. It is good for them to join sickle cell club or association. If they join sickle cell club, they can obtain more information about sickle cell disorder, meet other affected people, and learn about where to obtain expert counseling, proper treatment, and other useful services for themselves or for their affected children. So joining this association is important. So during the rainy season too, they should avoid being beaten by rain. Always carry your umbrella, raincoat, and rain boot during the rainy season. Avoid exposure to extreme cold or hot weather. Dress appropriately for cold weather and cold air-conditioned offices. It is some of them work in air-conditioned offices and they would like to dress anyhow. Before you know it, cold enters them and they are having crisis. Peradventure, you are beaten by rain. Please change as soon as possible to dry clothes when you get home. Have a warm bath, have hot tea or beverage, but not alcohol. Then they should move around the house to mild exercises to keep, so that they will get warm and that cold will go away from them. They should not go to bed straight away.
Okay.
Yes. Avoid long aeroplane journeys when you are unwell. If you have crisis on board aeroplane, report to the cabin crew and ask for oxygen and painkillers. They should eat any food. Eat your food. Any food you like to eat, you should eat food, but it must be balanced diet. Food that contains all the nutrients, carbohydrate, protein, like yam, beans, meat, eggs, fats. Then they should also take vitamins such as vegetables and fruits vegetables and fruits must be taken daily because natural fruits and vegetables have shown to be of superior nutritional value to those sold as pills or syrups. The natural ones we eat, oranges, banana, pineapple, all those, they have nutritional value more than going to buy the tablet and all that.
Okay.
Yeah, drink plenty of fluids, at least 3 to 4 liters of water daily. 75 cl bottle, 2 of it is 1.5 liters. 4 of those bottles is 3 liters.
Okay.
They can drink 3 to 4 liters of water daily. You can also take fruit juice, but not alcohol.
Okay.
Those who bed wet means they pass urine while sleeping at night. Please don't drink. It's part of the complications because their bladder cannot concentrate urine.
Okay.
Please, they also are encouraged to drink plenty of fluids. So if those who bed wet, please don't. Just make sure you don't drink after 7 p.m. and make sure you urinate just before going to bed. There's a long teaching on bedwetting if they come for genetic counseling. A child should drink about 50 ml of water per kg body weight daily. For example, if a child weighs 12 kilograms, you multiply it by 50 ml, that child will take like 600 ml of water a day, which is almost 75 cl. So, according to, I just use that as an example. We don't encourage drinks that have gas, like for children, like Coke, Fanta. It should be limited. All those drinks that have gas, like Coke, Fanta, for example, or it should be avoided. Excessive gas can cause abdominal distension, pain, or discomfort for children with sickle cell disorder. People with sickle cell disorder, they tend to accumulate iron in their bodies. And and excess of it can be harmful to various organs. So that's why they should not take drugs that have iron. They must not take drugs that have iron or vitamins that contain iron. I'm talking of drugs, not food.
Okay.
They can take any natural food. Egg has iron, milk has iron. We are not talking of that. We are talking of drugs because their body already have enough iron. So except if somebody is investigated, somebody with sickle cell disorder, a sickle cell specialist, hematologist investigate this person and they diagnose that the person has iron deficiency in addition to sickle cell disorder. That is the only time they can be put on iron, but it's not very common. Be very cautious of and avoid unproven herbal drugs.
Okay, very important. I mean, this one is even something that everybody should pay attention to, not even, survivors alone.
Oh, they should be conscious of this drug can cure sickle cell. This one can, and they are not proven to be so. It's just to extort money from them. So they should be careful. If they are not sure, they can come to the center to find out, or they can ask their sickle cell doctor if they have such. They should keep a diary of events, noting signs and duration of pain, medication that they use, and the effects prior to the events or other symptoms such as rigor when they are shivering with fever. They should learn to measure their temperature. If they have sore throat, they should note it down because all these records will help their doctors and healthcare workers looking after them to make the right diagnosis if they are sick. Then they should limit shortage of blood. Limiting shortage of blood means they should take folic acid. That is what they lack to make their blood. They should take folic acid 5 milligrams daily to prevent folate deficiency. This one occurs in people with sickle cell disorder because their red blood cells are rapidly broken down. So they have anemia, and what is short in their blood is this folic acid. So they must take 2 milligrams up to 5 milligrams every day to prevent this deficiency. And when they do so, it will prevent more severe anemia. All over the world, people with sickle cell disorder take folic acid. Then preventing infection also. They must avoid exposure to mosquitoes as much as possible. Wear long-sleeve shirts and trousers in the evenings and sleep under mosquito chemically treated nets at night. This will help them to it will help to prevent exposure. It will limit exposure to mosquito bites. Then, to prevent malaria, you take Proguanil. Proguanil is commonly known as Paludrin.
Okay.
Take Proguanil 200 milligrams daily. For children, you give Proguanil. Let me explain. 200 milligrams. One tablet is 100 milligrams. So if you say 200, means adults should take 2 every day. And for children, they take 50 milligrams. Half tablet to 1 tablet, 50 to 100 milligrams daily, according to the age of the child. Then pneumococci or bacteria commonly cause deadly infections in children with sickle cell disorder. So they are to take oral penicillin V twice daily. Yes. This one can prevent many of these infections. We give all children aged 2 months to 3 years 125 milligrams. Each tablet is 250 milligrams. So if we say 125, that's half tablet morning and half tablet in the evening. Until up to 3 years. Older ones should take 1 tablet of 250 milligrams twice daily. Then in addition, they should also take the pneumococcal vaccine, which should be given from the first year of life. Okay. Please, you don't just go and be doing all this on your own.
Yeah, you have to speak to a consultant.
Seek expert opinion on the names, the doses, and frequency of these life-saving vaccines or this treatment. So other immunizations that other children take, like polio vaccine, tetanus, measles, whooping cough, etc., they are also recommended to children with sickle cell disorder. They should take all of them. Then there's flu vaccine too. So influenza vaccine is a seasonal virus infection. So if you have sickle cell disorder, it is best prevented by receiving a flu vaccination once a year. If they avail themselves as specialists for sickle cell, and they will have access to all this. Then preventing stroke. What is a stroke? Stroke is due to the interruption of blood supply to parts of the brain. And a stroke may lead to partial or complete paralysis of the limbs, fits, convulsions, speech difficulty, intellectual deficit, or death. About 7%, that is 7 out of 100 children with sickle cell disorder aged between 2 to 16 years will develop stroke. So, and we go on to have further strokes if preventive measures are not applied.
Okay.
The initial stroke as well as further strokes can be prevented if the child receives blood transfusion or is placed on oral hydroxyurea daily. But the challenge is to identify the children who are likely to develop strokes so that they can be protected by applying one of these preventive measures. An ultrasound scan, there was a time I spoke on the what scan to prevent stroke in the management. Ultrasound scan preventing stroke in the management of sickle cell disorder. An ultrasound scan of the brain using transcranial Doppler, that's PCD. This one can identify children with a high risk of developing strokes. So therefore, all children aged 2 to 16 years, because between age 2 to 16, some children with sickle cell disorder can come down with stroke. So age 2 to 16 years should undergo transcranial Doppler, which we, in short form is called TCD scan, to determine their stroke risk. We have it at the service available at the National Sickle Cell Center, Sickle Cell Foundation, opposite Loot, Yaraba.
Okay.
Which, if high, anybody who is at high risk is qualified for stroke prevention by blood transfusion or hydroxyurea. The prevention of initial stroke is referred to as primary prevention. Secondary prevention is prevention of further strokes in a child who already had one. Because once they have one, if nothing is done, they can have another until they are debilitated. Prevention or reducing frequency of sickle cell crisis. They should make a note of activities. Is it climatic conditions? Is it food? Is it exposure to extreme cold weather, hot weather, whatever it triggers of their crisis? They should learn to avoid them. There was a time I talked on trigger factors of crisis and prevention.
Yes, you did.
Anything they notice that triggers of their crisis, they should avoid it. Hydroxyurea taken daily can reduce the frequency of sickle cell crisis.
Okay.
But it is not what they just go and take on their own. They should discuss it with doctors. It's not a cancer drug. You see, all those who take hydroxyurea, who are placed on hydroxyurea, their crises are reduced, they look healthier, they are happier. So, but it's not a drug you just go and buy at the counter. They should be under a hematologist who will give them a calculated dose and monitor them every 2 or 3 months. So they can discuss that with their doctor, the sickle cell specialist looking after them. The sickle cell crisis. How do you control sickle cell crisis when they have sickle cell crisis at home?
Okay, this is a good one. I'm sure a lot of people will pay attention to this one.
Okay. As soon as the first pain is felt, take 2 tablets of paracetamol.
Okay.
1 tablet is 500 milligrams. So take 2 paracetamol and repeat the dose every 4 hours, not exceeding 8 tablets per day.
Okay.
That's for adults. In addition, take ibuprofen tablet 600 milligrams for adults every 8 hours until the pain subsides.
Okay.
Do not take ibuprofen or a similar drug like diclofenac and so on. Don't take them on an empty stomach. Eat some food before you take them. If you weigh less than 50 kg, don't take 600 milligrams of ibuprofen. Take only 400 milligrams every 8 hours. Alternately, there is paraffin. Paraffin contains paracetamol and ibuprofen. An adult can take 3 tablets of paraffin 3 times a day after food. Or if they weigh less than 50 kg, they can take 2 tablets 3 times a day. For children, as soon as the first pain is felt, give oral paracetamol. There's paracetamol too, but I don't know how many people can have access to the one you insert into the rectum. But I know the one you give by mouth is readily available to everybody. So they can give paracetamol to the child, and they can repeat the dose every 4 hours. The dose is 750 milligrams for children aged 12 to 14 years. 750 is 1.5 tablets.
Okay.
Paracetamol.
All right.
12 to 14 years. 500 milligrams for age 6 to 11 years. That's 1 tablet. Then 250 milligrams for ages 2 to 5 years. 250 is half tablet. Then 125 milligrams for children below 2 years. That's quarter tablet of paracetamol. In addition, take ibuprofen, a tablet of syrup. For adolescents, they can take 400 milligrams. And for younger children, 200 milligrams 3 times daily with food also until pain subsides. Then alternately, children can take paraffin.
Okay. What's paraffin? Okay.
Paraffin.
All right.
Ibuprofen 3 times daily after meals for children under 12 years. 2 tablets 3 times daily to older children. To relieve early bone pain, hot fermentation, followed by massaging the site with gels or balm.
Okay.
Can be useful. You soak towel in hot water and place it at the site of the pain for about 10 minutes. Don't scald yourself. Let me call it in the layman's way. Don't burn yourself with hot water. Then massage the site with balm.
Okay.
Salicylate or ibuprofen. There's ibuprofen gel. There's diclofenac gel, ketofen gel, or any of the Chinese balm that you feel is suitable for you. Some of them know what is suitable for them. This can help to relieve early bone pain and prevent it from getting worse. But if you do not get better within 24 to 36 hours, please don't stay at home and say you heard on
the radio that you should self-manage. I mean, once you do all of these things and you don't get better, the best thing or the next thing is that...
For 36 hours. Even when counseling, I tell them immediately there are certain conditions that you cannot even wait, which I will mention before I finish now. So 24 to 36, you must... And if you are very pale, which means you are short of blood, you are anemic, and you are breathless, you just walk from the center of your sitting room or living room to the door, you are breathless. It means there's something serious.
Yeah.
So if you don't wait, there may be anemia. It may be that you are short of blood. Please consult your doctor immediately, preferably one experienced in the treatment of patients with sickle cell anemia. If there's no relief or there's fever, if you have pain with fever, don't even wait to be saying, I'm doing this, I'm first of all doing hot fermentation, and you can take ibuprofen with paracetamol, but when you get to the hospital, let them know you are taking something. Let them know you are taking something. If there's fever, go and see the doctor immediately.
Okay.
Don't think that every fever is due to malaria.
It's not always like that, though.
It can be due to a viral or bacterial infection, especially the children that can have pneumococcal infection that is very deadly. It kills within a short time. So, please, if you yourself have sickle cell, you have fever with your pain, or a child has fever with pain, don't waste time. Take that child straight to see the doctor. If the child is very pale, that is short of blood. If a child is pale, the palms are white, soles of it white, the eyes, you press it down, it's white, and the child is breathing very fast, and he has difficulty in breathing.
Okay.
Please seek medical attention without delay. Then learn to recognize when the child is pale or when you are pale. That is a sign of anemia. And the spleen is enlarged. It's only those who are come for counseling, we teach how to palpate spleen of their children under the ribs on the left side.
Okay.
When it's enlarging speedily, it means the whole blood is collecting there. There will not be enough blood to circulate in the system. It can suddenly become anemic. If care is not taken, it can cause life. So urgent medical attention is also needed when you feel like that.
We're totally out of time. I mean, we have exceeded the time that we should, wrap up on the show. So I'd like to say thank you so much, Ma.
I'm wrapping up now.
Yes, you're wrapping up, but the time has gone. But quickly wrap up so that I can just sneak it in.
Okay, all I needed to say was that they should come for genetic counseling so that they will get full, accurate information about self-care, about how they will care for themselves, and how they will manage themselves properly and live healthy, happy, and fulfilled lives.
Oh, all right. So where can they come for that genetic counseling? Please, I'd like you to give the address.
At Sickle Cell Center, Sickle Cell Foundation Nigeria, opposite Lut, Idiaraba.
All right. If they want to call the numbers, do you have the numbers?
Yes, I have the numbers.
Please do.
Okay, quickly. plus 2348035846666 2348100002003. One, my own is 09137347939. We are on Facebook. We are on email, info@sicklecellfoundation.com, www.sicklecellfoundation.com. That is website. Sickle Cell Foundation Nigeria Facebook, Sickle Cell Foundation Sickle Cell Foundation IG Twitter, then at Sickle Cell Foundation NG Instagram.
All right. Thank you so much, Ma, for joining me on the show this morning.
Thank you very much.
Yeah. Thank you so much. Have fun and enjoy yourself.
Enjoy your weekend.
I will try to. All right, just in case you're just joining, so sorry you missed out on the show, but we've been, talking about the guidelines of self-management of sickle cell disorder on Sickle Cell, Surviving Sickle Cell, the show brought to you by Sickle Cell Foundation Nigeria and Inspiration FM. On the show today was Mrs. Ayo Otaigbe. She's a retired director of Northern Nigeria Ports Authority, Lagos, and of course, now the head of Department Genetic Counseling, Sickle Cell Foundation Nigeria. She's also the lead genetic counseling trainer for counsellors all over Africa. Colade Dominates is my name. Make sure you start a trouble. Be good to yourself. I love you to the moon and back. I'll see you some other time. That will definitely be next week, Saturday. But